Look at this view. Severe aortic insufficiency AI is illustrated, but it's crucial to determine the etiology of AI as well as its severity. This short-axis view of the aortic valve shows thickening and calcification at the tips of the aortic cusps. This feature suggests rheumatic involvement. In this 3D view, you can clearly see the thickening of cusp tips. Now look at this echocardiogram of another patient. Severe AI is evident, but aortic cusps are thin and normal. In this case, the severe AI is due to dilated aortic root. The 3D view of the aortic valve demonstrates incomplete closure of cusps during diastole, secondary to the dilation of the aortic root. Therefore, in such cases, surgical management often involves aortic root replacement with preserved aortic valve. This is another case of severe aortic insufficiency AI. The aortic cusps are not thickened or calcified, but severe eccentric AI is seen at the junction of left coronary cusp and right coronary cusp of the aortic valve. The aortic root and ascending aorta are normal, but the left coronary cusp fails to coapt properly with the right coronary cusp. This 3D view depicts a prolapsed left coronary cusp. Aortic valve prolapse can be congenital or caused by connective tissue disorders like Marfan syndrome, infective endocarditis, or trauma. A subaortic ventricular septal defect (VSD) can also lead to aortic prolapse. In conclusion, determining the etiology of aortic insufficiency is just as important as assessing its severity, as it helps guide both medical and surgical approaches.